One of my cousins had been diagnosed with an ascending aortic aneurysm and had had surgery for it. Also, my brother had passed away 11 years ago from an ascending aortic aneurysm. When my cousin was diagnosed, his cardiologist said that there was probably a hereditary factor to this. All my family and I had been tested, and I was diagnosed with the aneurysm. And it was very large. When I was diagnosed with it, I found out pretty much right away that I was going to need surgery. I found that the type of aneurysm I had was in a very bad place, and it also involved 3 other arteries. So it was kind of weird because I was not having any symptoms at all. Right. But I'm just very fortunate that they found it when they did. And I was referred to Dr. Fiocco at Union Memorial. I had heard a lot of good things about him from a lot of people. When you mention his name, a lot of people know him already. When I met with Dr. Fiocco, he made me feel better. He's like, "You're okay." He says, we'll get you in here in the next few weeks. He said, "But you're all right until then." And that made me feel a lot better. And he checked everything out, and he said, "Yep, it looks as bad as I thought it was going to look." I just knew that I had no choice but to have the surgery, so I just had to kind of put myself in his hands and see how things went. I was very impressed with Dr. Fiocco because he explained everything to me, in easy to understand terms. He leaves himself open to questions. I can remember when we were all done talking, he says, "Okay," he said, "now what questions do you have for me?" He came out afterwards, after, I was out in the waiting room and stuff, told me not to worry, that everything was going to be okay. So I felt very confident with him right off the bat. He explained to me how they would, they sort of disconnected those 3 arteries and then, took the bad part of my aortic artery out, replaced it with a Dacron tube, and then reconnected those 3 arteries. And he says, "And I watch you, and I just make sure nothing is leaking. I make sure there's no bleeding. I make sure every stitch is in the right place and that every stitch is perfect." And he said, "I won't close you up until I know everything is just right." I felt like I was in good hands, and there was nothing I could do about it, and I just had to hope that everything would go okay. I knew that Dr. Fiocco's office was there if I needed them. They told me call any problems at all, and I actually did call them a few times because I was having a little bit of, wooziness and dizzy spells, and my blood pressure was kind of low, and so I called, and they were totally responsive. They wanted me to come in right away. His nurse examined me, and she was quite sure I was dehydrated, but while I was sitting in the examining room, she said, "I need to call Dr. Fiocco in the operating room because he's expecting me to call him and let him know how you're doing." So she actually talked to him while he was in the operating room with someone else. And I was just so impressed with that because I felt like my situation wasn't that serious, but he was really worried and wanted to make sure that everything was okay with me. Everyone told me when I told them I was coming to Union Memorial, "Oh, it's a wonderful hospital. It's a wonderful hospital for heart surgery." And I found that was true. They're totally prepared for that. They have a whole heart section. All the nurses and the techs are totally familiar with what your surgery is going to be like. They know just how to treat you. I had my own room. Everything was just set up, for me. And then the nurses and the techs couldn't be any better. They're anything you want, anything you need, they're there for you.